Thank you very much, Ala, and apologies that we're running slightly behind time, but the talks were so inspiring that we just we didn't want to stop anyone or interrupt anyone. I'm very honored to introduce the next speaker, who is Erika Harnik. Myself and Erika worked together back in 2017 at the Royal London when I was a clinical fellow. I had just started, came from overseas. Erika is now a Paediatric Immunology and Allergy Consultant in London. Nice to see you again, Erika.
Nice to see you, Nadia.
And yeah, the floor is yours.
Thank you. And I really wish that I had this advice when I was applying for GRID. It's been amazing. But I'll keep it subject specific because I think we've covered kind of what to do when you're applying for GRID and so on. So I specialize in allergy, but it actually comes under allergy, immunology, and infectious diseases. We're all one subspecialty. Let me see if I can move it forward. Okay, cool. So essentially, you usually choose one specialty, and actually I think for pediatric allergy, for GRID applications, you apply separately, whereas if you're applying for immunology or infectious diseases, you apply for that as it's a different interview process. But we all CCT, so I've just CCT'd, and we all CCT and the above. In any of the jobs, you work in a tertiary center with other specialties, PICU, adult allergy, immunology, lots of different specialties. And if you want to know a little bit more about what we cover, the progress curriculum for PAID is on the RCPCH website. Definitely, like everyone else has mentioned, look at the GRID person specification for applications. And what I'll do is I'll talk about allergy because that's what I know, but I'll give you some contact details for infectious diseases and immunology. It's a 3-year training post, but they can count training prospectively. So I applied in ST6 and I had a job doing immunology and dermatology. And so I had that counted towards my GRID application. So I've actually only done 2 years full-time equivalent of allergy training. And for allergy, it's a really small specialty. So there's 0 to up to 3 jobs advertised a year. And the centres are London, Southampton, Manchester, Newcastle, and Cambridge. And in terms of fill rates, so you can see this is last year, 6 people applied and there were 2 jobs. So it's more that, and the year that I applied, there was 1 job. So it's more that there's not many places rather than there's lots of people that are interested. Job opportunities at the end. So I guess the hope or when we apply is that we'll be tertiary allergists. I was kind of resigned to the fact that actually for me, geography was really important. So if there wasn't a tertiary allergy job, then I'd probably be a secondary care allergist and have some general peds as well. But I was lucky that there were tertiary allergy jobs coming up. And then the other option is research as well. And lots of people have a joint clinical and academic job. In terms of opportunities for developing allergy experience, so BPAG, that's the British Paediatric Allergy Immunity and Infection Group, is an excellent group, and I'd really recommend joining. It's £25 for trainees, and they do 2 training courses a year that are 2 days, full days, completely free. And when they used to do it face-to-face, your accommodation was paid for as well. So £25 per year isn't much at all. But the teaching is absolutely brilliant, and it's mandatory teaching if you're doing GRID. So it would just give you a flavor of what the kind of topic areas that are covered. For allergy, there's the British Society of Allergy and Clinical Immunology. There's a conference coming up. It's really easy to get a poster presented there. So if you've got anything remotely allergy related, then definitely submit it to that. You can do further trainings, so MSCs, diplomas, PG certs, or even just modules, but that's definitely not a requirement, and it doesn't give you lots of points. So if you're not interested in doing those further educations before you apply for GRID, then don't bother. Allergy Academy is another place that does lots of education for free. So I definitely recommend that. And OOPs or OOPTs are definitely worth your while. I took a year out after ST5, but I would recommend to try and get it counted towards training if you can, because it just means that your training takes forever. Most importantly for any of these three specialties is to approach your friendly allergist, immunologist, infectious diseases specialist, because they're all really small specialties. For all three, actually, because I've worked in all three, everyone's really friendly. They've always got projects on the go. So if you want to do an audit or a project or present a poster or a case study, there's lots of opportunities. If you just approach them and say, I'm interested, then someone will definitely help you. Why choose allergy? Definitely choose allergy out of the three. It's because it's a multi-system disorder. So it's really interesting. It really crosses over for general pediatrics as well. So lots of opportunities to develop kind of special interests. You're not kind of super specialized in one part of the body. And even, you know, famous people, I think it's Amalia out of the Obamas who has allergy. For allergy also, the research opportunities are amazing. So our understanding of allergy is changing all the time. And so the research is really at the forefront. So if that's of any interest to you, and even me without a research background, you know, I've had a chance to do a bit of research, which wasn't too scary actually. So if you don't want to do grid, and it is a really, you know, because the posts are few, grid isn't for everyone. I would really recommend doing a spin. And that was my career plan initially, was to do a spin. And then I was converted and I applied for grid. And I'm sure people have gone over spin training with you before already. But essentially at the end of it, it means that you can be a general pediatrician with a special interest. But actually for the tertiary jobs where I was applying, grid training wasn't an essential criteria. So it was a desirable criteria, which means that if you were a spin trainee, then you could actually apply for those tertiary allergy posts. So it means you've got options for tertiary allergy, but also if you want to stay as a general pediatrician, with allergy, you'll do a bit of gastroenterology, a bit of dermatology, a bit of respiratory. It means that you can apply for lots of different general pediatric posts with a special interest, and you can kind of mold your spin in allergy towards what they're looking for in the application. So I think doing a spin in allergy will keep lots of doors open for you. So I would really recommend that. In terms of contacts, you're very welcome to email me. I'm really happy to help anyone. It's erika.harnik@nhs.net. I'll put that in the chat. But if you go to the BPAG website, if you click on the three specialties, allergy, immunology, and infectious diseases, then they have trainee reps for each of those. And so I would just email them, say you're interested, and they will know who to put you in contact with locally so that you can get a bit more information or get involved with projects. So yeah, that's me, nice and short and sweet, but I'll just put my email address if you want to contact me.
Thank you very much, Erika, and it's really nice to see you again. Thank you.